Good morning, ladies and gentlemen, Honorable Minister of Health, UNFPA Rwanda Deputy Representative, dear government officials, heads of international and local organizations, fellow young people, distinguished ladies and gentlemen, all protocol observed, good morning. Well, age is just a number in this room, and everyone is considered youth. So please, I need that energy. I need to feel that we are together and we are ready to kickstart our day. So good morning. Good morning. We are almost there. Good morning. Good morning. I can take that. My name is Taina Dizeye, a final year medical student at the University of Rwanda, and I'm very grateful to be your MC today. I'd like to wish a very warm welcome to you all to this ICPD Follow-Up Action 2023, which is jointly hosted by the Ministry of Health, UNFPA, and AFRIAN Rwanda. The theme this year is youth engagement in the implementation of the country's commitments. This session, ladies and gentlemen, gives us an opportunity to engage, to learn, to share, and really evaluate the progress that we have made as stakeholders since the dissemination of the action in 2021, and discuss the next steps forward. Feel free to live tweet as we go on. The hashtag is ICPD30 Rwanda. Hashtag ICPD30 Rwanda. Tag the Ministry of Health, tag AFRIAN, tag UNFPA, let the world know what's happening and share what's sticking out for you today. Without further ado, Honorable Minister, ladies and gentlemen, I'd like to invite Dr. Evode Niyibizi, Country Director, AFRIAN Rwanda, who's going to shed light on youth engagement and how it's been so far. Evode, you're welcome.
Thank you very much, Taina, my colleague. Honorable Minister, Deputy Country Representative of UNFPA and Office in Charge, distinguished government officials, heads of UN agency representatives, and heads of country development partners, colleagues, stakeholders, partners, and my fellow young people, good morning. Good morning. I'm very, very pleased to be standing here as I try to shed light on probably a concept which is just here, ICPD. I know it happened to me some years back when I got to know or to see ICPD. I was pretty much confused and I couldn't understand what it was. And it's just easy. Let's just go 29 years ago. That was in 1994 in Cairo, Egypt. The International Conference on Population Development, ICPD, held in Cairo, was a pivotal event that aimed to address pressing global issues related to population growth, reproductive health, and women's rights. The summit resulted in a landmark agreement known as the Cairo Program of Action, or ICPD Program of Action, which recognized the link between the population dynamics and the sustainable development. It emphasized the importance of empowering women, promoting gender equality, and ensuring universal access to reproductive health care and family planning services. The ICPD Cairo Summit led to a groundwork for a more comprehensive and right-based approach to population development issues. So, how did we get there? Rwanda was not represented by that time. But again, as a fastest developing country it ratified the ICPD program of action. You know, all the transformative changes that has been happening before 2019. The reduction in maternal mortality, the advancement of sexual reproductive health, the gender equality, and so on. So the impressive part is that Rwanda has been doing all of that with the great involvement of young people, but it also keeps doing its best to see how we can further engage young people to capitalize on them as the major population of the country. So how did we participate in that? I was engaged in the ICPD in 2019. Where the countries, multiple countries were working to renew the commitment at the occasion of the 25th anniversary of the ICPD in Nairobi. And part of the activity that were done to do that, we had young people also playing their own part. One of the example is the National Youth Traveling Caravan that we did in 2019, which was engaging young people to see how can they participate in shaping the commitment, the 6 commitments made by the government of Rwanda in Nairobi Summit. So let's look a bit of what we have done, from the 6 commitments that we have done in Nairobi, and the action plan that we have shaped right after in 2020, and the way it has been started to be implemented in 2021. Then last year, on 16th March, we did like the reflection on the commitments to see where we were. So with the help of UNFPA, together with, of course, the Minister of Health allowed us to sort of see how we can reflect on the achievement we have made in that meeting of last year. And in the next video, we'll see exactly what was there. And the UNFPA Rwanda.
If we don't invest in our young people, then instead of them becoming an asset, they become a liability. And by being a liability, the progress that we've made so far could be one that could be a challenge for us. Rwanda is on the right path, and I'm proud as an African to be in Rwanda because you are making it, and we need to keep the momentum.
The meeting intended to do the self-evaluation on the progress made since the dissemination of the action plan and shaping the next steps towards achieving the Rwanda commitments with a focus on the meaningful and inclusive youth participation towards achieving the universal access to sexual and reproductive health and rights by 2030. As part of the key resolution of this meeting, it is very encouraging to see how the country recognizes the role of young people in achieving these commitments, and we will continue to support the meaningful and inclusive youth participation in the process. The government of Rwanda will continue to scale up the implementation of the comprehensive sexuality education for in and out of schools, girls and boys. The Ministry of Education committed to keep educating young girls on sexual and related areas around pregnancy and sexual transmitted disease, since they also have an impact on the reduction of the teen pregnancies.
One of the areas of focus is teenage pregnancies. And those teenagers fall under my portfolio as Minister of Education. So the majority of them are at school, and I believe the education sector, if they are well educated around sexual health and of course prevent the pregnancies at early age.
Adoption policy making, designing a more programmatic approaches to ensure responding to the issues that affect the targeted population.
call the youth to own and engage in sexual reproductive health services, especially family planning, as for their own benefit, to build the capacity of youth-led organizations to be able to support the progress for youth.
It is very encouraging that Rwanda is recognized among countries that spearhead programs of achieving a number of targets, including advancing women's rights, access to family planning services. However, we still have a long way to go. Universal access to sexual and reproductive health and right for all is being changed today as never before. The progress of family planning uptake has slowly increased since 2010 to 2020, and nearly 15% of women in Rwanda still have an unmet need of family planning.
The ICPD agenda means a lot for young people. Inspired by the leadership of the government of Rwanda, as young people, our commitment is to ensure proper accountability in the implementation process to ensure the accelerated realization of the commitment made by the government of Rwanda. We aim to be at the forefront of the implementation process for a country where we live a quality life with dignity, capacity, and opportunity to realize our full potential.
Following the meeting of last year with the resolution that we had at this meeting, also AFRIAN, as a youth-led network of youth-led organizations in Rwanda, had one resolution to work on. We have managed to map countrywide different youth-led organizations beyond. There are more than 30 youth-led organizations operating in Rwanda, linked to the ICPD program of action. And we, during the mapping, also we did their capacity assessment to see how we can shape their capacity building plan. And as part of that, we also had an opportunity to train 25 young champions of ICPD program of action. We are prepared, as we committed last year, as never before, and we are ready to take responsibilities. So we assure the government, the Ministry of Health, and the other partners that we dare to lead the changes. Thank you very much.
Another round of applause, please, for Evode. Distinguished ladies and gentlemen, Evode's presentation and the testimonies in the video are again an encouragement that we are on the right path. And the fact that only young people will be facilitating today's sessions, it's exciting, we've walked the talk, and thank you for doing that. It's my pleasure now to welcome another young and talented lady called Christiane Uwase for a song performance. She's a talent nurtured by Art Ubuhanzi. And in her song, she encourages young people to work together towards development in every way possible. Thank you very much. I hope you enjoy the performance.
Morning, ladies and gentlemen. My name is Bukuru, and I'm going to cover one of our best-known artists, Kayirebwa. I hope you enjoyed the performance. Mundeke maririmbire, mundeke ndirimbe, mundeke cyane ruhuje mundeke baririmbire mundeke nze ndirimbe mundeke nge ndirimbire uba nawe yemwe yemwe rubyiruko bavandimwe biwacu yemwe rubyiruko Rwanda rw'ejo cyo haguruka tugende dufatanye urunana maze indatana twitwa z'ubu butwari tujye gutanga umwanzi wa twese mudindiza mu majyambere amajyambere y'u Rwanda rwacu duhora batoye indatwa ko bafite amatwara ateye ubwuzu bana b'iwacu dore izuba ry'inzoza rirabasekera neza dukomezanye ingango umugambi wanyu juranga bana b'iwacu dore izuba ry'inzoza rirabasekera neza dukomezanye ingango umugambi wanyu juranga murakoze cyane.
Thank you very much. Oh, that was a wonderful performance. It deserves another round of applause. Distinguished ladies and gentlemen, I am pleased to now invite Ms. Renata Talariko, UNFPA Rwanda Deputy Representative, for a presentation as we reflect on the journey on delivering on ICPD 25. You're welcome.
It's very difficult after such a beautiful performance. Luckily, I'm not asked to sing, which is great. Good morning. Honorable Minister of Health, Dr. Saben Nsanzimana, senior government officials here present, development partners, in particular representatives from SDC and COICA, UN colleagues, civil society organizations, AFRIAN, ICPD youth champions, all young people here present today, members of the media, distinguished guests, ladies and gentlemen, good morning. It is absolutely my pleasure to be here this morning with you today to discuss such an important topic, our commitment towards the ICPD, but also the role of young people as we push the agenda, and specifically adolescent sexual reproductive health agenda. Let me start by thanking the Ministry of Health and AFRIAN for organizing this important meeting, and also thank all the participants who have joined us this morning as we take stock of the progress and areas for acceleration. And let me stress areas for acceleration. 2030 is very close, and we must accelerate, and narrowing the focus will allow us to get as close as possible to the goals we have set for ourselves. The adoption of the program of action, as Yvonne clarified to us earlier, was really the beginning of a new era of commitment and willingness of governments, the international community, and civil society to integrate population concerns into economic, social planning, and policy making. The ICPD program of action recommends that population issues should be integrated into formulation, implementation, monitoring, and evaluation of all policies and programs related to sustainable development. This was reaffirmed 25 years later in Nairobi in 2019, and this is even more important as we get close to ICPD 30. Realizing sexual and reproductive rights is grounded in the human rights of all individuals to have their bodily integrity, privacy, and personal autonomy respected. These rights depend on access to and choices in high-quality services and information, tailored to different stages in life, and free from discrimination, coercion, and violence. One of the commitments we made at the Nairobi summit was to ensure that nothing, and let me stress nothing, about young people's health and well-being can be discussed and decided upon without their meaningful involvement and participation. They always say nothing about us without us. I used to be the UNFPA youth advisor for Eastern Southern Africa. And if there's one thing young people and young leaders across the region has been quite consistent, is that they really do not want us to decide for them. And they want to be part of the discussion, active part of the discussion. Let me also take this opportunity to add that sexual reproductive justice is linked to universal health coverage, a promise made in 12 commitments as well as in the Sustainable Development Goals themselves. And without mentioning the Agenda 2063, Vision 2050, there are many framework documents that commit to universal health coverage. Our journey started almost 30 years ago towards a world of rights and choices, a world with universal access to sexual reproductive health and rights, a world where no one is left behind. Today, we'll take stock of the progress on the commitments, identify how young people can be engaged in ASRH to avert obstacles that hinder the implementation of the commitments themselves, and agree on required actions to accelerate progress and achieve the Rwanda commitments. UNFPA remains committed to support the government of Rwanda in accelerating action as we realize the commitments and we reach ICPD 30. Ladies and gentlemen, before I conclude, let me take this opportunity to once again thank the government of Rwanda, AFRIAN, our development partners, particularly SDC and COICA, and other partners for their continued support to this noble cause of accelerating the progress of the ICPD agenda. Earlier, we watched the video where the UNFPA representatives said, I'm a proud African to be in Rwanda for the progress that Rwanda made towards the ICPD and the promises that Rwanda is keeping towards the ICPD. I'm not African, but I'm a mother of African children. And I'm proud to be in Rwanda, and I'm proud to see the commitment of the government of Rwanda towards ICPD. And more than that, I'm proud to see this room full of young leaders who are pushing this agenda for the present and for the future. Thank you very much.
Another round of applause, please. Thank you very much. Distinguished ladies and gentlemen, it is an honor to now welcome the Honorable Minister of Health in Rwanda, Dr. Sabin Nsanzimana, for his remarks.
Good morning. Naramtse. Rahunez. Great. Thank you. UNFPA Deputy Country Representative, It's actually a great pleasure to meet you for the first time this morning and welcome you to Rwanda. Mr. Evode, the head of AFRIAN, that we have worked together for many years. I remember during ICASA 2019, before the pandemic. And of course, my sister from WHO that work daily on health issues. We have Imbuto Foundation representative, and of course my colleagues from ministries that are looking at youth, but also on health. Youth is as important a group to make things happen and drive the change for the lives of people. So thank you so much, DG from Ministry of Youth, for joining this meeting, and representative of young people, and everyone. I see leaders of different organizations in the room, and I see young people. I see the energy in the room. I missed my t-shirt this morning, so I could have been feeling better with you. And it's always good to join young people when we talk about commitments and achievements. So thank you for coming to this meeting that we co-host. As the moderator, Dr. Ange Steiner, mentioned, that the Minister of Health, the UNFPA, AFRIAN, have been working on this together to make sure that youth engagement, empowerment, the commitments to improve the lives of people, starting from young people, is achieved. So it's a check-in for us, how we progress on these achievements. Sometimes when we see these big acronyms and topics, we think this is not for us. So I will try to make it easy and simple, as you said. There are just a few things that we need to achieve. Number one is to make the lives of mothers and children better. It has to be understood, these lives of people, our mothers and sisters, that we have to protect, that they should not die while giving their lives. So that is not an option. It's not something we do as a secondary activity, or we may choose to do it or not. So it has to be mandatory. It's a priority. It's a top priority. Currently, the maternal mortality stands at 203 per 100,000 live births. This is an improvement from 1,000 deaths per 100,000 live births that we had 10 years ago. But we're talking about people with names. So 203 is a lot per 100,000. So the commitment, and the biggest commitment, is to move it from 203 to less than 100 in the next few years, if possible, in a few months, and is achievable. Because there are countries, the programs, there are actually districts within our country that have already achieved that target. It's a matter of coordinating our efforts. It's a matter of learning from each other and using data and facts to see what works to prevent this maternal mortality. Because we know the top 5 reasons why we are losing our sisters and our mothers. So for you young people, I see young doctors, medical students, nurses, midwives, scientists, researchers. I can recognize many faces in the room, but there are others that I'm still yet to interact with. But everyone has a role to play. Even in your community, you can do something. The little you do as an individual, at individual level, makes a big change at the community, at the country level, and at a continent level. So to me, out of the 5 commitments, or 6, I don't remember exactly the exact number of things, if we can achieve this one, we'll have made 80% of the biggest commitment we have. So let's start from now. Actually, should have started yesterday. We've done some steps, but we should not be satisfied with the little changes if every single day there is someone dying from preventable death. I think Dr. Teopista has worked with us in my previous role at the University Hospital in the South. We were counting every single step every day, trying to reduce maternal and children mortality, checking daily how should have done better to prevent every single case. And in a period of 3 months, by going aggressively to statistics and actions and equipments, staff, space, supplies, we found that actually you don't need billions to make these changes. You just need focus and empathy and feeling it that you own it. It's not a job that you're going to do and go back home and say that I'm going back to my job, to my work tomorrow. It's that, what have I done today? How many people have I impacted? How many lives have I saved? How many people have made happy? Because I'm in charge, because I'm a student in medical school, I'm practicing, because I'm a nurse, because I'm an accountant, making sure I don't hold emergencies waiting because I want money to be paid first. The first thing should be save the lives, then money can come after. So understanding that is important for you, young people, for the leaders in the room, and for us with the responsibilities to make sure that it is coordinated at a sector level with our partners, because at the end of the day, we are working for the same people. Those who, as I always say, have never gone to school, they don't even know who is UNFPA, who is WHO, who is Ministry of Health, Youth, Education. So they don't know those acronyms. They don't know ICPD25 or something. What they need is just for us to make their lives better, at least saving them. Then this is how we all connect in the same place. So I'm sure I'm repeating things you already know, but this is a time to rethink how we achieve our missions and our commitments. Sometimes we sign things, I'm committed to do this, then after, if you don't check on yourselves, you've signed so many things, don't even remember. So, saving lives of mothers, saving lives of children, it's not negotiable priority. It has to be our day-to-day focus. And as a country, we want to demonstrate that we can achieve less than 100. When I say less than 100, I'm towards 0, because even 1, it's a lot. Even 1, it's a lot. So that is commitment number 1 in our reflections. Commitment number 2 that connects to that is financing. How do we invest in these priorities, in these programs? So we're coming from a pandemic, at least the active phase of it, emergency phase, that has taught us that investing in health programs, it's not an expenditure, it's actually a seed you're planting because it's going to grow and help other sectors like economy, education, and others. So when health is affected, everything else is affected. So we all go home, stay, lockdowns, we don't go to school, we don't go to our daily business. So this is what the government of Rwanda has been doing. So we already understand that investing in health is actually not an expenditure. It helps the economy, it helps the security, it helps the lives of everyone. That's why the Abuja declaration that has been said, it should not be a number that we aim at just adding 1% and we're comfortable. It should be just a reminder that if you can overinvest in health, you will never regret that. And it is happening. You're already seeing that. And these trends, these indicators are have converged to one overall indicator, which is the life expectancy of people. And we have fresh data from census report that was published this year in Rwanda. I encourage everyone here, young people, to read it. Read that report, that it gives you the picture of the progress of a nation, of a country. So life expectancy reaching 70 years in Rwanda is a summary of all the contributions that have been invested by different sectors, especially the health sector, by preventing maternal death, children protected, but also social sector, education, economy, and people live longer, happier, healthier, and now we are at the levels of investing in making sure that non-communicable diseases are not going to bring us, to take us behind. You don't want someone to live 70 with diabetes, hypertension, and can't even move or run to go to see his or her children. So that is the quality of life you're talking about. So for young people in this room, it's even important for you, as you're still fresh, full of energy, that you plan in the next 50 years. How do you want yourself to look like? Your body, your legs, your arms, your eyes, your head, everything is not going to be replaced. It is the same. You're going to live with. Your body will not change. There's no spare parts for like we do for cars. Medical surgery can do things, but the majority of who you are will remain with you in the next 50 years. If you are 20 today, in 50 years, you will be the same. So now, the question is, how are you investing in your own body, in your own brain, in your thinking, in your working, in your relationships, so that in the 50 years, you are the best of yourself you want to be? Is it by drinking 6 bottles of alcohol every day, what WHO defines as heavy drinking, heavy drinker? Heavy drinker is the one who takes 6 bottles at any occasion. And mostly the occasions are frequent. These are heavy drinkers. So I can guarantee that in 50 years, if you continue at that pace, some of your parts and your organs will be destroyed. And you'll be a burden to our health system, if you're lucky to be alive by then. And you'll be a burden to your family, to yourself. So the choice is yours. But at some point, it's not yours. It's a community thing. it's a country, it's a nation, it's a development thing. So, 6 bottles or 2 liters of water a day. Choose. What do you choose? Because sometimes shortcuts are not always, actually most of the case, shortcuts always scam. Shortcuts always scams. That's drinking. Now what about eating? If you eat these pizzas and breads and sugar and salt and every single day, because it's tasty for you, but it's toxic to your body, and we know that. Even doctors, they know, but sometimes what they do is different. So you have these toxic, sometimes we call junk food, and you have healthy food, vegetables, fruits, water. And actually in our context, this junk food is mostly expensive. You're eating meat every day like as if you're a lion. Lions have specific body system and organisms to digest all those meats. So, but in the morning, breakfast meat, lunch meat, dinner meat, brunch meat. Sometimes, you can't sustain your body in the next 50 years with that kind of lifestyle and eating. This easy way of living, it's easier, it's cheaper, it's healthier, and even your brain will be happy because you reward yourself by having done what is right. That is eating. What about movement? We were told by historians that actually, and people who maybe philosophers, that God has created us with legs, with joints, because we have to move, have to walk. We're not supposed to sit and stay. We're supposed to be moving. This is what God created humans, anatomic, in doctors understand. In anatomy, there's joints to move, you stop. So all the movements of the joints are meant for something. So our behaviors have created another way of using it differently, which is different from what the nature was supposed to follow. So we were meant to move with our legs, with our arms, with our bodies, with our head, looking left and right, up and down. But if you look at the current ways of living, it's the opposite. You're sitting 8 hours or 10 hours a day, and facts, evidence is clear that when you sit, the internal organs will compress themselves, the joints, the veins, arteries will be blocked. Imagine 8 hours a day for a month, for a year. After 5 years, you start to feel different. You can't even go to run and grab your kids or even hug your friends, your girlfriend, boyfriend, because you've become already a different person. So this is a reality. This is a reality of things that we're investing in which are not right. So please choose between sitting or moving. That's the third choice. We should add that to our commitments. The third choice. Choice of moving or sitting and sleeping and standing. Sedentarity, that's the term. Sedentary lifestyle kills. And it kills slowly, that you notice as you age, as you regret that if I knew I could have done this. And when it has happened, accumulated, it's hard to correct and to go back. When you're already obese, when you already have increased by 30 kilos to your weight, and doctors are telling you, go back and cut 28 kilos, you just give up. Say, doctors are crazy. It's impossible. But you have to take actions before. So our culture has to be updated to our lifestyle of today. Like drinking milk, drinking alcohol, this in our culture, it's like, it's okay. You can drink milk. A lot of milk is good, which is not true from medical understanding. Milk is not bad, but a lot of milk is not good. So, as Ministry of Health, as our partners, we should tell people this is the milligram of salt you should consume per day. This is the milk you should take per day. Otherwise, you have these risks. So I'm trying to make this conversation real and practical, beyond just general good text and themes that maybe doesn't touch on our daily lives. So you sit or you move. I see even cars taking people up to the entrance of the door. Because you see that moving from the parking to the entrance of your office is too long. 100 meters or 50 meters. Take that advantage. Give yourself opportunity to move, to walk. Walking is not a sign of not having means to pay a motor or a car. It's actually good for you, for your community, and for the country. That is choice number 3. Now, choice number 4. We live in a very stressful lifestyle. You see how people, even sitting together, 2 individuals, chatting on mobile phones, they make themselves busy, but at the end, you check and evaluate what have you achieved by just staying like this the whole day. And our phones now are tracking how much time you spend on the screen. They will tell how you've spent a lot of time on your screen. It could be dangerous to you. Our phones are clever and smarter than us, reminding this guy or this lady is going to die. So what is happening is what we see in the medical books that is being included. I don't know if you've heard about text neck. It's a new disease that is affecting the neck, the cervical part of the neck, so that people are suffering from this part because the weight of the head, I think, is above 7 kilos. That is pulling down the structure that is not supposed to carry that heavy weight long time. So text neck, read about it. It's a new condition that is happening because people are always bending themselves. And there's somewhat joking that we will probably going back to where we came from. You remember how evolution, where we used to be like that now. So this in terms of the lifestyle. So we are making ourselves busy, chatting, texting, staying nights on space. As the space, you know about this space thing, conversations overnight, people are talking about something, then they stay several hours up to midnight. And the next day you wake up early morning because you have to go to work, then you're sleeping at the office, then you stay, then you chat, then you take a lot of coffee, then Friday you are very busy, then you're tired, then you take a break by having those challenge number 1, still remember, 6 liters. So, how do we make time for work, time for break, and time for self-care? Because mental health is as important as physical work, as physical health, as the daily interactions and social things. So, make time for our mental well-being, because we see a lot of cases of mental mental health increasing, and they're linked to the lifestyle, how people work long hours, several hours a day, and the brain doesn't have even time to synchronize. So no, these IT people, sometimes they say, okay, we're closing the office, we're going to synchronize the computers, the systems. Our brain is like that. So when we sleep, we're synchronizing the information, everything is reporting back. So it's restarting a laptop or a system or a computer. So why we don't do the same for our own body? But we do it for our computers, for our labs. I see people working in labs here. You see there's a time they contaminate the lab because you're not sure about the infections in the lab. So you close the office, close the lab, you fumigate, you clean everything. So for our body, we don't even do checkups. We're not robots. We're humans, we are vulnerable. We can have conditions, can have diseases. So let's start from there. That is challenge number 4. So number 5 is now, what is our value? What do we bring to our communities? Is if you choose to work individually as a person, you can make steps, but you will not reach far without others. The responsibility we have as humans is to help each other, to work together. So that is the mission we have on this health and life. So our value is key, and you don't wait to be a minister, to be a UNFPA deputy country representative, or the director of AFRIAN, to make value or to change the lives. It starts with your small environment, the room you sleep in, the community you work with. So let's make that value. That is how we ourselves have values in our communities. And you are very few people who went to university. Most of you have went to university. It's only 3% from the census report. So you're the one to change the lives of others who are waiting to see what you went to study in schools, in conferences, what have you brought from KCC back to your schools, your offices, the communities. So that brings to excellency of what we do. If you're a photographer, be the excellent photographer. Make the best picture from your tools. Get the best tool. Work for it. If you're a doctor, you're a surgeon, make the surgery that will not be infected. Be that midwives that will make sure that all the women you follow, you know their status. Now no one is going to bleed because you didn't check that. If you're a lab scientist, do the same. Make sure you don't miss the diagnostic. If you're a leader, make sure you don't make bad decisions. Use facts, use evidence, and so on and so forth. So I didn't follow the usual protocol of making a speech because I wanted to be free and give what I feel with you, with this audience, that everything I talked about fits in this discussion, that our commitments have to be achieved, and saving lives, investing, being the right drivers of change is what it means to come together. So thank you so much, and have a great discussion.
Thank you very much, Honorable Minister, for sharing your wisdom with us and for the powerful call to action and commitment towards achieving these commitments. Ladies and gentlemen, we are about to take a 20 minutes health break and networking break. in which I'd like to invite all of you to please visit the exhibition booth. We have amazing organizations bringing to you innovative and creative projects and products that we would love for you to all check about. With your permission, Honorable Minister, before we get to that break, we would like to take 2 photos. For the first one, I'd like to invite your table to join the front row for a quick picture. Yeah. With our smiles on, cameramen, we are ready for you. Okay, 1 step forward. Thank you. So. Perfect. Thank you. We'll get to the second picture. I'll ask everyone in the room to quickly, in 1 second, join us here at the front for a family photo. Youthful energy, quick. Please join me here on the stage. If you're not feeling well, that's fine. But for those who can, please come here at the back. We still have space. With our smiles on again. Okay, we can. The young people can put hands up. ICPD25. Yes! That's the energy. Thank you so much. Let's please be back in 20 minutes, and our guests of honor can be ushered by protocol out of the hall. Ladies and gentlemen, I'd like to invite you to please join your seats so we can get started with our second part of the program today. So for those of you following us online, feel free to tweet, and we are keeping track. In the course of our discussions, feel free to ask questions, which we will make sure to look at and inform the panelists. And for those of us here, I have an assignment as we wait for people to come back. Hello, are we together? Okay, so I'd love for us to take a selfie real quick with those next to us. Put on smiles, take a selfie, and let's tweet using the hashtag ICPD30 Rwanda. I'll wait for you. If you don't have anyone close to you, you can move to the next table. Selfie time. If you're just coming back in, feel free to take a selfie with those next to you, and let's please tweet or use any platform of your convenience. Could be Facebook, it could be Instagram. Post that picture, tag UNFPA, tag the Ministry of Health, tag Afrian, and let's keep the conversation going. A round of applause as he comes on the stage, please.
Deputy Country Representative of UNFPA, government officials present, dear partners present, youth and distinguished ladies and gentlemen, good morning. Today it's a pleasure that we are now discussing on youth engagement in sexual reproductive health, especially their journey, their work, as well as the expectations we expect from them to help their group, the world, to achieve the sustainable development through implementing some ICPD's commitments. So the aim of those ICPD commitments, as they have been discussed, said in previous speeches, it's to make sure that there is accessible sexual reproductive health, to ensure our mothers goes through experience the safe pregnancies, they deliver live babies, and to ensure the development of our newborns, our children, and also to cross through the adolescence safely so that we can have future mothers, future fathers, future entrepreneurs to help and support the whole globe to achieve the sustainable development goals that they have been stated in, they have been committed by different countries. So next step, next slide. So the journey, as it has been stated, Rwanda joined the ICPD commitment in 2019, and they have been approved in 2020, and currently we are implementing them. And for us, we really align them with our existing strategic and development documents, which include the National Strategy for Transformation, NST1, the Health Sector Strategic Plan, which runs from 2018 up to 2024, as well as other strategic documents related to maternal, newborn, and child health, as well as family planning and adolescent sexual reproductive health. Next. Those commitments have been grouped into, there are 6 main groups. And the first one was already achieved by our country of allocating the budget of more than 15% to the health sector. This has been achieved by the government, but of course, we need to sustain and channel those resources towards the main priorities of our country, which are maternal health, reproductive health, as well as adolescent health. The second one was to ensure that there is necessary legislative policies and different strategic framework so that they can really guide us during that journey of ICPD25, while we'll be reprogramming existing programs, innovations in our programs, but also other interventions to accelerate the achievement to accessible and available sexual reproductive health services to our population. The third one is to decrease the maternal mortality ratio and increase antenatal care attendance. Of course, we are along the journey towards achieving the 0 maternal deaths. So this really requires different interventions, including improving the quality of antenatal care services for our mothers. The fourth one is to make sure the adolescent sexual reproductive health services are utilized adequately and accessed, of course, by increasing the demand, but also by improving the quality of those services in different settings. The fifth one was to improve family planning uptake and decrease unmet needs of family planning. And the last one, but not the least, is to strengthen the governance systems which really use reliable data if we don't have data, if we don't count, we don't count. So next. On the first commitment of allocating the budget to health sector, especially by the baseline, I can say like a baseline, or the minimum was at least to achieve the 15% of budget of the country to be allocated to health. This already has been achieved, and of course, there are other commitment, other interventions like adolescent sexual reproductive health investment case, the family planning investment cases, which have been done to guide us to advocate the allocation of resources to sexual reproductive health through our different partners, different organizations, different civil society, private sector, as they are among the key players to achieve those ICPD25 commitments. Next. In ensuring the necessary legislative to improve sexual reproductive health, as well as to empower our women and adolescents, we are in a revision of a ministerial where we have extended the legal indications or the legal framework by leaving from previously we used to have safe abortion services to be provided to those with life-threatening conditions or life-threatening pregnancy, but now it has even extended up to those with incest, those pregnancies from rape, child pregnancies, or at least, and all those indications now, at least they can allow the vulnerable youth, the vulnerable mothers, to ensure that they can access those safe abortion services. Also, there is a ministerial order which determines the role of each institution, especially in health in adolescent or health in reproductive health. And also, we have also been able to develop a 5-year condom strategic plan, which allows different public sector social marketing of those for those condoms, so that they can be accessed at earliest, and also can also be accessed by different groups who are susceptible to different issues. And also, we have also, our country has endorsed the FP2030 commitment in 2021, which also aims at accelerating the achievement of different countries, and especially in our setting for Rwanda, to accelerate the achievement or the uptake of family planning services, but also to decrease the unmet need of pregnancies, as well as other adolescent, as well as to decrease adolescent sexual reproductive health issues which are being faced by our adolescents. Next. On improving services, especially delivery services, the access and uptake of different health services, especially antenatal care services and others, with the aim of decreasing maternal mortality rate. towards the zero maternal death vision of our globe. We have also made sure that the urinary pregnancy test is being made at community level so that it can allow our mothers to know earlier that they are pregnant, but also to start the seeking care in antenatal care so that we can ensure that the health of our mothers as well as the health of our fetus or newborns also can go well through that journey of pregnancy. We have also been able now to introduce the ultrasound services at this facility at health center levels, where currently now almost 1/3 of our health centers can provide ultrasound services to our mothers, and this really allows them to detect any abnormal any problems during pregnancies, and then they can be referred early and taken care so that they can also experience a safe pregnancies. And we expect that by this year, the end of this year, we will be almost having more than 2/3 of health centers will be providing ultrasound services to our pregnant women. Also, we have also revised our antenatal care to line it up with the new antenatal care guideline of WHO, where now it allows frequent contact of our pregnant mothers and our healthcare providers. This will create the friendship and also the self-esteem of our mothers towards our healthcare providers, but also it will allow us to detect any problems which would have arisen between the long interval of the visit we have been having previously of 4 visits, and now from 4 to 8, we are sure that many of the issues of our pregnant women will be detected during antenatal care, and then they will, it will allow us, our health system, to provide the quality care to those women early, and also to prevent any complications which would lead to maternal death or perinatal death. We have developed many documents related to maternal health, adolescent health, which including the guidelines, the training manual, and so on. We also did the EMOC need assessment, which really showed us where the gaps are so that it can help us to reprogram our maternal health and reproductive health programs so that it can really respond and to different gaps which have been identified in this mock need assessment. There is also, currently, we have shifted to specialized community health workers to polyvalent community health workers, where each community health worker may provide a full package of maternal health services, child health services, as well as other services have been included in it. And now we are sure that there is we have ensured that any community health worker can now provide those services, and this really it allows the continuity of care rather than the referrals which have been being from one community to another community, because one have been having some services which are special to one, another one with others. So this really was causing that this continuity of care in our community. There is also the government of Rwanda, in collaboration with different partners, have continued to increase the health facilities, and especially more than 18 second generation health posts have been constructed in different areas which are remote to health centers, in which our mothers may even now access maternity services in addition to antenatal care and other sexual reproductive health services. And also, more than 43 health posts have been constructed, and this also allows the access to decrease the geographical barriers to access the health services in our country. And also, furthermore, we have also, the government of Rwanda have been able to construct and upgrade one maternity in Kabgayi so that it can really also serve as a teaching hospital. And from this one, we will ensure that also our in-service student, pre-service student will also be able to acquire different skills, or necessary skills and knowledge to provide different reproductive services to our mothers. Next. In increasing the demand on adolescent sexual reproductive health services for all Rwandans through raising awareness in the community, has been, last year we have been able to conduct the assessment on the functionality of youth corners, which are almost those youth corner services. We have been able to integrate mentoring in our existing mentorship programs. And also, we have been able to engage youth peoples in sensitization of community in SRH area at all levels. And really, today is also, on this point, it is where we expect to continue to engage our youth towards the achievement of this ICPD25. Also, the SRH, adolescent sexual reproductive health services, have been introduced among the package of services which should be provided by our community health workers, and this also allows us to remove the barriers on access to SRH services to our adolescents. And more than 80,000 peer educators in school as well as out of school, they have been trained so that they can support our youth and adolescents on SRH information, as well as some religious leaders have also been trained so that also they can also play their role towards our journey to the achievement of those ICPD 25. Next. In improving family planning services, as well as the accessibility and uptake, and decrease the unmet need of family planning services, we have also revised our existing family planning guideline so that it can also include the current new family planning methods, but also to include the management of side effects of those, the management of side effects of family planning methods, so that also this can also help us to ensure our women are safe throughout family planning use. We have also been able to introduce the new methods of family planning, in especially the depot medroxyprogesterone, DMPA, which is subcutaneous, which we expect that not women don't need to go in his facility to get this method, but they can even inject it by themselves since it is subcutaneous and it is safe. We have also introduced in our existing method the hormonal intrauterine device. Previously, we used to have only the copper intrauterine device, but currently we have introduced this new method, and it is among the methods which also has been introduced in the preschool services or of in the preschool nursing school schools of our universities, so that we can ensure that there is a sustainable delivery of that method in our health facilities. There is also social marketing, but of emergency contraception pills in partnership with different partners, especially SFH, UNFPA, and others, so that our adolescents, our mothers, may access those pills to avoid those unwanted pregnancies. Of course, there is existing mentorship, there is existing outreach services, especially to the permanent methods, because in our settings, those permanent methods, vasectomy and tubectomy, they are provided at the hospital level. And given the distance from the community to the hospital, it's a long distance. So to ensure that our community access those permanent methods of family planning, we have the continuous outreach programs to provide those services to the community. And really this is showing a good impact, especially in increasing the uptake of that permanent methods. We have also integrated the family planning in postpartum, where now the postpartum family planning is now around 60% in our all health facilities. Next. So in strengthening the governance and also the use of data to program to guide or to drive our interventions in SRH, there is an adolescent health data, some adolescent health services data, safe abortion data, and other maternal health and reproductive health services. They are being monitored regularly in our health management information system, and these are the basis when we are planning different interventions, not only on the government, but also our partners. Also, there has been a census in 2022, and among this population census, which is national, it includes also some indicators related to maternal health and sexual reproductive health in general. And it has shown us that Rwanda currently has a fertility rate of 3.6, and we target that by 2024, we will be reaching the fertility rate of 3.2. And this has shown that this is really achievable. In terms of governance, we have technical group meetings, maternal health technical group meeting, the adolescent sexual reproductive technical group meeting, newborn. We have different technical group meetings which meet regularly to share the achievement, the challenge, and together they take measures to reprogram and strategize our interventions from the Ministry of Health, the Rwanda Biomedical Center, as well as our partners. And also, I would also, on the use of data, I would also like to inform you that Rwanda also have joined the global FP2030 visibility analytics and network platform or coalition. This also will help Rwanda country to also to have a visibility on the use of family planning products, and this also will help to have a consistent supply chain of family planning commodities in order to address some gaps related to the supply chain in the provision of family planning services to our community. Next. So, of course, we still have some challenges, especially legal challenges on adolescent sexual reproductive health, where adolescents between 15 and 18 years to access sexual reproductive health, especially only on family planning services, there is a need to have parental consent. And this is really a challenge because we know that our adolescents also, they need their confidentiality in accessing those services, given some cultural barriers of our parents, of our community. There is also, of course, even if the government is working hard to sustain the allocation of the budget to the health sector, there is also still some financial limitations, especially in funding some family planning interventions and commodities. There is also a big issue of shortage of health workers, and especially this also has been shown by the assessment on the functionality of youth corners, where even if we have them there, but the services are not provided at the pace our adolescents really would like them. So this also is a challenge, not only in the health posts, but also in our health facilities. Of course, we need the involvement, the continuous partnership of different stakeholders, government, civil society, UN agencies, private sector, as well as youth, so that we can remove those barriers and also strengthen or accelerate the implementation of those ICPD commitments toward the achievement to zero maternal deaths, zero neonatal deaths, zero gender-based violence, and also to ensure that our future adults, women, are empowered so that they can also help us to accelerate the achievement of sustainable development goals as they have been stated in ICPD Commitment 25. Thank you very much.
Thank you very much. Another round of applause for Dr. Regis, please. Thank you very much, Doctor, for the refresher and insightful presentation. Ladies and gentlemen, we are moving to Rava Mubyiza tujya mu bindi. Next is a panel discussion, which is going to be engaging. We hope that you interact with the panel, keep your questions and comments for the end. But before we get to that, I would love for all of us to stand and do a very quick energizer to kind of get ready for this panel discussion. So my friend, if you can come and help me. Okay, I think Evod was also ready with one. Please come. Both of you come. We'll do this from the front. Please, come. Is everyone on their feet? The Honorable Minister advised that we should move our joints. Move, especially after the heavy breakfast we've just taken. So please, the floor is yours.
Okay. Thank you. We're going to do a very simple energizer, sort of shake our crumbs, yes. This is one that I learned from my friend Eric there. We're going to do this. So we all know how to count, yeah? So 1, 2, 3, 4, 5. 1, 2, 3, 4, 5, with your head then. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Then we move to 1, 2, 3, 4. So we lessen the number, and then when we get to 0 and 0. Yeah? Awesome. You ready? Awesome. So let's go. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 1, 1, 1, 1, and 0.
Wonderful.
Awesome.
Thank you so much. Please allow me to invite on that note our very able Annette Mizergwa. She's going to be moderating the panel and she will introduce everything about it. But I would like to let you know who is Annette Mizergwa. She's a highly creative registered nurse in Rwanda that holds a master's degree in global health on gender and sexual reproductive health. She's an enthusiastic global health leader and an advocate for meaningful and inclusive youth participation. Over the past 5 years, she has gained experience in the field of sexual and reproductive health and rights, in program management, youth and women empowerment, community engagement, policy and advocacy, to mention but a few. She's one of the young people that actively participate in national decision-making platforms to contribute to vital consultations, technical working group meetings, conferences, advocacy, especially anything that has to do with reproductive health and rights for adolescents. She's currently the SRHR advisor at HDI, and she's an amazing lady and a colleague of mine for now a couple of years. So please show some love to Annette as she takes over.
Thank you very much, Dr. Onsteiner. I am so excited to be the moderator of today's panel. Do you know what we're going to discuss? Does anyone in the room know what we are going to discuss? I always love a vibrant audience, so I expect you to do that for me. Hello? Okay, perfect. Oh, you're energetic. You're ready. So thank you very much. My name is Annette Mizergwa, like I said, but I have a couple of amazing people that will be joining me on the panel for a discussion. And our discussion is going to be talking about social accountability, but especially the relationship between the youth and the adults or bigger organizations on how they can ensure the realization of the commitments we've been talking about, to break it for you guys. I know you have it on the agenda, but I want you to understand what we are going to be discussing, so that's why I had to re-echo it. So I have amazing people joining me on the panel, and I'm sure you would like to know who they are. Primarily, the first person that will be joining me on the panel is Dr. Renata Talarico. A round of applause. Dr. Renata is the UNFPA Deputy Representative. She joined the Rwanda Country Office recently in April, and she is the immediate past youth team lead and safeguarding young people program region coordinator in the UNFPA SRO. She's working with UNFPA in different capacities for over 14 years. Did you hear that, young people? Yes, 14 years. Prior to joining UNFPA in 2009, Renata worked in non-government organizations and academia. She holds a PhD in international and European law with a focus on human rights law and a master's degree in international relations, a certificate from Stanford University on international health, women's rights, and a certificate in leadership from the Said Business School, Oxford University. A round of applause for Dr. Renata. I learned how to pronounce her name as Dr. Renata Talariko, and I'm so proud that I managed this time. So thank you, and it's important for me to tell you who I am inviting to the panel because you'll see the relevance. So when I'm reading the bios, it's not just for the sake of reading them. Be sure to follow and know who is going to be talking to you. Next on the panel, I have Solange Tetero. Miss Solange Tetero is the Director General of Youth Empowerment in the Ministry of Youth and Culture. A round of applause as she joins the stage. You're welcome. She coordinates Government of Rwanda programs on youth empowerment and ensures that national youth policy is implemented in all sectors across the country. Before joining the ministry, Solange worked extensively with Imbuto Foundation on youth programs at the grassroots level with a particular focus on health. Solange is also one of the best performing girls awarded by the First Lady of Rwanda in 2009 and 2011. A round of applause for that. Yes, currently completing her master's degree in public health with Suffolk University, UK, Solange holds a bachelor's degree in soil and environment management from the University of Rwanda. Finally, Ms. Tetero holds a certificate on farmer-led agriculture extension from Japan and has extensive knowledge on agriculture digitalization from the Technical Center of Rural Agriculture Corporation, Netherlands. A round of applause for Ms. Tetero Solange. Like I said, I would love if we talk about someone, you'll have to understand who we're inviting to the panel and give a round of applause to them, and you're doing an amazing job. Thank you. Up next, the next speaker is Mrs. Isabel Kalisa, a woman of enthusiasm. I've met her a couple of years ago, and whenever I see her, the first impression is I just want to smile. She's so jolly. So Miss Isabel Kalisa is a public health professional, passionate, and she has interest in health policies and adolescent sexual reproductive health. And she has occupied different positions in the area of public health, promotion, abroad and in Rwanda. She joined the Imbuto Foundation in 2013. Her education background and qualification, along with professional experiences, different health and social sectors, have allowed Isabel to acquire knowledge on social issues that are linked to individuals and community health. Isabel has actively participated in various community engagements, designed various health promotion strategies that contribute to healthy, enhancing behaviors of the Rwandans, mainly the areas of girls empowerment and adolescent SRHR, family planning, and HIV prevention. Finally, Mrs. Kalisa holds a master's degree in public health promotion from Leeds Beckett University in the United Kingdom. A round of applause for Mrs. Isabel. Yes, and finally on our panel, we have one of the youth representatives, a colleague of mine, Evode Nibizi. Dr. Evode, you're welcome. Dr. Evode, yes, a round of applause. Yes, Dr. Evode is a passionate youth leader dedicated to promoting SRHR, especially for young people in Rwanda and beyond. And he has a background in medicine and surgery, which makes him a doctor, absolutely, I say that. He has 6 years of experience in advancing SRHR for young people and driving impactful initiatives to prevent SRHR, sexual and gender-based violence, and promote meaningful youth participation. He is currently the country director of Afrian Rwanda, and beyond Afrian Rwanda, he has expertise that extends internationally as a member of the Global Youth Board for the Generation Gender Program, representing 7 countries. Evode's commitment to youth empowerment, SRHR, and gender justice has made a significant impact, propelling Afrian as a leading force in advocating for SRHR and gender policies. Finally, and most importantly, I want you to know that he is a national delegate to the Nairobi Summit on ICPD25. That was 2019, so a round of applause. Makes a lot of sense to this meeting. And he's also been appointed to be the youth focal point at the region and the regional young champion of the ICPD program of action. A round of applause for Evode. Now, I know that was long. I know the presentations were really long, but they were important for us to understand who we are going to discuss with and why. So I want to discuss with the panelists today. But you will allow me to sit with them. Is that okay? Or do you want me to stay standing? Okay, sure. Let's start. Let's sit with the panelists. So I'll start with a quick one that I would like everyone to respond to in probably the few seconds that you can. When you talk about youth engagement in realizing ICPD 2030, what does it mean to you? We'll start with you, Solange.
To me, it means young people being part and parcel of what is happening in their country, and also being in the driver's seat to be the one implementing and making sure that those commitments are met.
Thank you.
To me, is a strategy to avoid failure.
Strategy to avoid failure.
65% of the population is youth. If you don't involve them, what are we exactly doing?
The vote.
Yeah, and to me, it means the journey that we took in shaping the commitment, planning for their implementation, the implementation part, and the monitoring and evaluation to make sure that we are on track.
Thank you. Yes, Isabel. Yes, I was wondering, what does youth engagement to the realization of ICPD 2030, what does it mean to you? The microphone.
Not leaving any youth behind, making sure that they are participating in every decision making around their health, around any of these 6 commitments.
Yes, thank you. Could you allow me to thank the panelists with a round of applause? I'll tell you why. Yes, I requested you to thank them because for us, if we do not understand the meaning of engaging young people, then we cannot discuss any other thing. Now, to the tough questions that the audience would like you to address, I'll start still with you, Tetero. What opportunities exist for youth to participate in policy and decision-making process related to SRHR at the national, regional, and international level? You will speak as the DEJ of Youth Empowerment in the Ministry of Youth. Thank you, you're welcome.
Thank you very much, moderator. First of all, I see you're both in red. Yes. When I was coming here this morning and as I entered by that door, I saw that everybody else was in black. And I was shocked. And I asked to someone who had invited me, why didn't you tell me that everybody else is going to be in black so that I can also put on a black dress or a black shirt or something for me to look like others. And then I saw the moderator. She's also in red. And I concluded that actually red and black means love. And love is a very important element to health. So thank you. Coming back to the opportunities that are there for young people to participate in the policies and strategies on sexual and reproductive health, I think that's a very important question. And for me to answer it, I'll start by what's there. Because we have a lot of policies and strategies from the global level to national level, actually to community levels, that are really keen to addressing the issues that are in the health sector, and all of them talk about young people being at the center of driving these changes that we are envisaging as a country and as the world in general. excuse me. Thank you. Starting by Sustainable Development Goals, I think all of you might be aware of these goals. And I think it's very important as young people and partners in the room for us to be aware of what's in those goals, because we are the one to implement them in Rwanda. And the fifth goal speaks about achieving gender equality and empowering all women and girls. When you dive deep into that very fifth goal of SDGs, you see that it has around 9 objectives. And in those objectives, there's one that specifically speaks about supporting young people to access sexual reproductive health. That is the commitment that was made by all countries across the globe to make sure that young people have access in a youth-friendly manner to sexual reproductive health information for them to be able to make, informed decisions on their lives. And again, when you look in the Agenda 2063, which is the agenda of the Africa we want, of the African Union, it speaks about universal health coverage. And that is intended to make sure that people across Africa can have access to health, can have access to services, to quality services, to be able to lead, better lives, to be able to contribute to economic development and so on. And that is an opportunity, having all those policies talking about universal health coverage, talking about health, talking about sexual reproductive health, that is an advantage for us young people. Now, coming back to Rwanda, we have the National Strategy for Transformation 1, NST1, and it has 3 important pillars. One being economic transformation pillar, second one is social transformation pillar, and the transformational governance pillar. And when you dive deep into the social transformation pillar, you see that the government of Rwanda is committed to making sure that all Rwandans have access to quality health services. And that is our biggest commitment. And I think today in the morning, the minister spoke about how the government sees, how the government sees interventions that are intended to support all Rwandans to access quality health services. And again, because I know the NST1 is ending, and I think all of you know that it is ending next year, now the country has put in place the Vision 2050, and the mission of the Vision 2050 is to ensure that Rwandans acquire high quality and standards of life. And again, it is to make sure that Rwanda reaches the economic growth that is intended and prosperity for all Rwandans. And that is not possible without a better health. So now coming to opportunities. When we talk about all these policies and strategies, it means that there's political will. Like the government is keen to supporting whoever wants to go in that same way of making sure that all people can have better lives. And it is an opportunity for young people, especially because we are in a developing country, because I always joke about us being a developing country. We're not supposed to be a developing country for years and years. At some point, we have to be a developed country, because when we say developing, it is a journey, one step after another towards development. And that is what the Vision 2050 is intended for, to make sure that Rwanda becomes a developed country. And being a developing country gives us an opportunity to address so many challenges. And in those challenges, as young people, we have to see opportunities, because that means a lot of young people who are being impregnated at early age, teenage pregnancy. That means a lack of enough facilities to support young people to have access to sexual reproductive health. That means our youth corners in health centers that are not operating as we would want them to operate. That means young people and children dropping out of school. That means malnutrition that Minister Sabe talked about. And all of those challenges are an opportunity for us young people if we can bring a solution on the table, and the government will support us, because the political will is there to make sure that those solutions are implemented. Then, as when we'll be solving those problems, we'll be able to make a living out of that solution that you have brought. And that is what we do together with UNFPA and Digital Foundation through iAccelerator, where we support young people with innovative ideas in addressing health issues like sexual reproductive health and mental health. I'll pause by there. Thank you.
Yes, thank you. Using the existing problems to create opportunities or to leverage the opportunities there. On that same note, when you talked about iAccelerator, I'm curious, I'm not going to ask you about iAccelerator, but I want to know, what do you think, how can we leverage technology as young people? How can technology and social media be leveraged to make sure that these commitments are put to realization, but also to engage the youth and create awareness on ICPD commitments?
There's what people call the New World Order. Yes. And in that New World Order, I think technology is the driving force. It is an enabler to all other services. So if, as young people, we cannot leverage technology for us, number one, to communicate, and for us to access information, then that will be a very big problem. Because through technology, we can reach to many people in a go. And as the globe has become a village because of technology, we have to be able to take advantage of technology to be informed, but also to inform others. But again, we have to make sure that we, as young people who are educated, who have the opportunities that other young people do not have, because in this room we are less than, I don't know, I didn't count, but I can see we are not more than 200. That means they are 3 million and more, because in Rwanda we have more than 3 millions and 500 and more numbers of young people. That means that 3 million of the young people are not in this room. So how can we use technology to make sure that the information and all we've got in this room is communicated to other young people in the community? But again, how can we support those who do not have knowledge on how to use technology for them not to be misled by what is on social medias and other platforms that is not correct? Because one of the challenges that we are facing now is the use of technology in a long way that is misinforming our communities, making young people take misinformed decisions and leading to many challenges that we are facing today. So I think we have to be there. We have to be on social medias. We have to be on YouTube, Twitter, Instagram, because that's where most of young people are, and it is an enabler for us to be able to communicate. But also we have to be able to support other young people to use that technology in a better way and leverage opportunities that are there.
Yes, thank you very much, Tetero. A round of applause for her, please. I always ask for a clap very many times. I hope it is not bothering. A round of applause again for Tetero Solange. Thank you for being cooperative. Now I will go to our youth champion on the panel, Dr. Yvonne. Sorry. How are youth voices, including marginalized and vulnerable youth, being in those populations? How are the voices being amplified in their respective categories to be represented in the implementation, monitoring, and evaluation of ICPD commitments, the national ones?
Well, thank you very much. I'll start by maybe if everybody is going to think about the ICPD as we talked about it in the morning, for us as young people, it's not an abstract thing. It's not like something that we see here on the banners, on the papers, that we are not part of. I remember back in 2019 when we were shaping these commitments, the initial stage had a bunch of commitments, and then they were narrowed to the 6 commitments. And in the initial process, from the national level, we came up with a team of 4 young people, and my colleague Annette was part of my team. I was leading the team as a privilege, yes. And I was lucky to work with her throughout the 10 districts to do consultations to see how we can make the voices of young people being included in shaping the commitments. Because in the end, if we were going to shape the agenda that were to respond to the issues that they are facing, if the commitment weren't integrating their voices, we wouldn't do anything. So they couldn't be benefiting for these commitments. So basically, the consultation that we did took that into consideration, taking young people or youth as not an homogeneous group. So just taking into consideration the different categories, the people with disabilities, the young people living remotely in hard-to-reach geographical locations, and even more categories of the young people. So the same way we did that should be the same way we do the implementations. So we committed at Nairobi Summit, and then we came back, we shaped the action plan for the implementation. And the group that went to come up with the action plan also was very inclusive. That was one of the battles that we made still back in 2019. That's when I joined like the ministry, the technical working group of at the Ministry of Health. So, and one of the motive or the duty, the responsibility that I felt like I had was to make sure that at least as young people, the whole country, young people can't go at the same technical working group. But how do we get represented in a comprehensive way? I remember for the first time when I claimed that, they told me, you are a young person, you're representing all young people. But I said, no, this is a technical working group for adolescent and youth. And how comes that it is made up by 90% adult people? It doesn't make sense. So we kept discussing, but luckily the members understood that, and then they advanced that we can have like, an improved composition of the members of the technical working group. So that's from there, because through those technical working groups, we monitor the implementation of the ICPD agenda. Mm-hmm. So even though I can represent young people, I can be the focal point of the ICPD, I don't technically or at the same time have a holistic understanding or a holistic voice, mm-hmm. an amplified voice that can speak for everybody. So the amplification of the voice that I have is kind of generalized. But there are specificities that we need to have on those technical tables that young people need to voice by themselves. The way we claim that there is nothing about us without us, the same in those categories of young people. So we need at least to get the meaningful representation. And if I say the meaningful representation, I am referring to the representation that used to be there. Different meetings like this happening, and then we invite young people to just be present. And in the reports, you see that we are having a big number of young people attending the meeting. But who spoke? Mm-hmm. And what has been taken into the minutes of the meeting or what? You keep seeing that these are bigger people or people who believe to be big speaking on behalf of the others. Their quotes they want to be captured and shape the next steps for something that they were discussing about. So the meaningful or the amplification of those voices is changing that narrative to bringing young people. We capacitate them with knowledge and skills for them to be able to tackle their issues by themselves. Yes. In the coffee break I was discussing with Deje, she was telling me, how do you make sure that young people are not just engaging or claiming, raising issues without participating in finding solutions for the issues that they are raising? And my answer was quite simple. These are some of the approach that we try to shape. We understand that because we believe that we need to take the responsibilities. Mm-hmm. And we believe that the solutions are among ourselves.
Yes.
Recently, we took one step backward and we evaluated ourselves, the youth-led organizations and the ICPD young champions who are here. Eventually, we went back, we looked. We always claim to be working through youth-led organizations and so on, but what are we doing? So do we even understand what we are doing? So we went back to understand how do we decide on what to do. Deja has been speaking about different agenda, the NST1, which is about to end next year, the NST2, which is going to start. What is the process to design the NST2, the ICPD agenda, the SDGs. You could find that the majority of the young people who participated differently weren't understanding all those abstracts, like the acronyms and so on.
Yes.
And then we went to just changing the mindset. We sit down, we understand first where we come from, and we understand the vision that we have, where we're trying to go. So that's one of the successful ways to amplify our voices through our interventions that are informed by the country priorities. And the way we're very vibrant physically, we get the ideas which are very vibrant, we get the interventions which are very vibrant to transform the country, leading it to the vision that we want.
Yeah.
So basically, that's the holistic way that I feel like the amplification of the voice should be going with young people that I represent.
Thank you, Dr. Evode. I'll get back to you asking you more questions about how these successful youthful initiatives can be replicated and amplified, to inspire future engagements. But for now, let me ask Mrs. Isabel. Yes, I'm about to ask you about partnerships, because this panel is about how we can partner as young people with different NGOs, different government ministries. So I want to ask you, how can partnerships between youth-led organizations, governments, civil society, and other stakeholders be strengthened to support the effective implementation of the ICPD 2030 commitments?
Thank you, Annette. Partnerships. I would say building partnerships is like building another relationship. You should invest in partnership. You should trust the partnership. Before I go to how, I think I want to stress that partnership is very important and it's very crucial as they generate customized solutions to local needs. So we respond the question into going by two key points, purpose and goal, the trust and the communication. For the goals, there should be an active engagement with a shared focus. Thank you. Sorry, menyamutumvise. So I just said purpose and goal. To build stronger partnership, you need the purpose, you need goals, there should be communication, there should be trust. In terms of purpose and goals, there should be active engagement, engaging everyone with the shared focus to address the commitment or any other need. For the communication, I think there should be wide ways to share information and knowledge between CSOs, between NGOs, the government, because government alone cannot achieve this commitment without partnering with different institutions. Also, the joining or joint efforts to monitor and evaluate the commitment and making sure that the youth are engaged, everyone is engaged, and also making sure that each partnership is evaluated as well. Because I believe to have it successful, you need to evaluate the partnership and see if there is any added value to the commitment or to any other things. Thank you.
Thank you very much, Isabel. She reminded us about having a goal and making sure that this partnership is contributing to a shared need or commitment, and that's really important. I'm wondering, so my follow-up question on that question would be, what strategies do you think can be adopted to ensure sustainability of the engagement of the youth? That was your last point. So how can we make sure that the youth are continuously engaged beyond in these commitments and beyond these commitments, sustainability of youth engagement? What do you think should be done?
I just said involving youth, and I hope they were engaged in elaborating this commitment, because it should engage the youth in consultation, in design and monitoring. They should be part of that process. To make sure that M&E frameworks are sensitive and relevant to youth. What I think is strengthening youth-led agencies as well. You should invest in youth-led agencies or institutions. If I give an example of Imbuto Foundation, we believe that working with youth-led organization or institution will help us in terms of sustaining what we have achieved in the community, at the community level, but also disseminating our positive impact in the community. So making sure that the youth-led organizations are invested in and make them relevant. You know, it's not being there, not supported, no staff, no financial support or anything. And then involve them in joint decision making, making sure that the youth are equipped to take appropriate actions. If you're not involving the youth, how are they going to be relevant in what you're planning to do? And in addition, creating enabling environment. Enabling environment will help or will be, what can I say? Enabling environment will help, we make like a way for youth to be involved in every step. You need also to setting guiding principles on how the youth will be participating in that and in the implementation of the commitment. The last one is the youth should be ready. The youth should be ready. You may have enabling environment, but the youth are not ready. So as the minister said, what are you investing in you to participate, to making sure that these commitments are achieved? Because we need the youth to be involved. You cannot say we have enabling environment, we have consulted the youth, as Dr. Evode just said, but the youth should be ready to be part and take part in that.
Yes, thank you very much, Isabel. Are we still together, my lovely audience? Are you still here? By show of hands, please, just show me you're still here. Okay, okay. That's not bad. You're still here. Thank you very much for staying with us. And I would like to remind you that we'll have a session of questions and answers. So if you have any questions for these panelists, please be sure to note them down as I ask some of the final questions. Now, I'll come back to Dr. Renata. Dr. Renata, we've been talking about youth engagement. The two pre-current panelists talked about youth engagement. And we've been talking about ICPD 2030, ICPD 25, and we've been saying it over and over again, but I want you to help us understand and connect this to country priorities. How do you think the meaningful engagement of young people contributes to national priorities, either social or economic? She talked about the NST one, either social or economic. How do you think meaningful engagement of youth contribute to this, in the implementation of ICPD 25, contributes to national economic and social priorities?
Thank you very much, Annette. I think my answer is very easy. Actually, the minister made it very easy when he said that health is the foundation in everything we do. The ICPD commitments are about health. And I also said earlier that is not involving or not young people is not a question. Is non-negotiable in a population where 65% of the population is young people. For me, you know, I found it very interesting. I've been working in youth work for the 14 years you mentioned. And I always find it interesting when people ask me why should we involve young people. It's a question that has very obvious answers in very many ways, especially when you talk about adolescent sexual reproductive health and rights. They know better than we do. We might call ourselves specialists, experts, advisors, very many titles and nomenclatures, but at the end of the day, the ones who have living experiences of what it means not to get to services in time or not to know about the existence of services is the young people themselves. And I want to also stress what Yvonne just said. Young people is not one category of person. Youth is a segment of the population. Within the segment, there are very many types, variables to be considered. So the biggest mistake when we talk about youth involvement, participation, either effective or meaningful, we use very many terms. The bottom line is that we need to give them access, we need to capacitate them, we need to hear them. They have a voice already, we don't need to give them voice, yes. We need to listen to them. But them, that word them includes very many of them.
Yes.
Right? So yes. I think that's fundamental. So I may not have directly responded to the answer, but for me the bottom line is that is not even a question.
That's not
young people need to be in the forefront, if I may say, of the ICPD and broader, all the government initiatives needs to be guided by them, because at the end of the day, they are the ones who will be carrying them along as we move in time.
Yeah, drawing from your 14 years experience working with young people, what do you think internationally are the lessons that can be learned from other countries or regions that have successfully engaged the youth in the implementation of similar commitments?
Yeah, no, thank you for this, and I'm glad you are drawing from my previous experiences yes. too. It has been a learning curve for us that we're supporting the young people and the young people themselves. I think it's a learning curve, but one thing that has worked is institutionalization. Asking young people to be at the table shouldn't be an ad hoc request. It should be a must. It should be institutionalized. It should be given, right? And so there are very different mechanisms for that to happen. For instance, there might be youth advisory panels that government would like to institutionalize. I know majority of countries have national youth councils, for instance, that could be act as such too. But institutionalization is the bottom line. Also in Parliament, for instance, let's not forget it is not just about the executive. We also have the legislative power. So how do we influence the legislative power too? How do we ensure that we have young people represented there too, that can share their experiences? But I want to also draw to one important point. Being at the table comes with rights and comes with duties.
Yes.
As it's not just a matter of I want a seat at the table. It's also a matter of what am I going to do with that seat? And how I'm going to ensure that I feed back to my constituency, because whoever has that seat is a representative of a larger constituency. And as Yvonne was saying, sometimes that weight is heavy on your shoulders, but it's also your responsibility to go back, listen to the people you're representing, make sure that your voice is not only Renata's voice, but is the voice of the many people I represent. And sometimes what I want to say might not necessarily match with what my constituency wants me to say. And it is okay, because I'm not just representing me, I'm representing others. And that's part of your duty as a youth representative.
Yes.
So institutionalization from a government perspective, from a system perspective, but also from a youth-led organization or from a youth leader, acknowledging that when you represent somebody, you don't represent yourself or the people you know or the social status you have, or you know, the minister talked about the 3% of young people who have
University.
masters, I believe, university
Actually,
access.
university bachelor.
Correct? 3%. They are out there. There are many others that do not have that fortune. So how do we represent those voices? I think it's a very important point if you want to be fully fledged leaders. And I think I can say it because I did start this career of mine when I was very young, and I used to be a youth activist. And I know the challenges also of trying to represent others, but how we need to really reflect also as young leaders on how to do that.
Yes, thank you very much, Renata. Thank you very much, dear panelists. A round of applause to my panelists, please. The round of applause sounds like it's coming from hungry people. Can you add another round of applause, please? Yes, thank you. Thank you for staying with us. Now, dear panelists, I know time is not on our side, so I would like people to ask you questions if they have some. So if Taina is going to help me identify some questions, and I'll have two people, a male and a female, who will have the privilege to sit on my seat to ask the questions. Part of the people that will ask the question, you just ask the same question, you know, just sitting in my seat. Doesn't it feel good? Don't you think it will feel good? That's just a way of giving, you know, meaningful participation, especially for the youth. So any questions in the audience? Raise your hand, very swift. We are, yes, I see hands at the back and I see hand at the front. I am not going to give any other chance, so if you have questions, raise your hand right now. Yes, those are many. I think we're strictly going to take 4 or 5. Okay, 5, sure, that's fine. But can I ask the people who have questions to stand up, all of you? Is that okay? Please, yeah, please stand up. The people who have questions. Yes. Okay. Now, may I have 2 of you, youth? Do we have a male in the people that stood up? I can't see, the light is really a lot. Yes, we have a male. So I'll ask one male to join, to come here, and then another female. Who's the female youth representative that wants to come? Take the chance quickly. Okay, yeah, that's her. Let her come, you come, as we listen to the first question. Go ahead.
Thank you. My name is Eme. I'm working with SDC. I'm happy that all the panelists at least mentioned that youth are not homogeneous group, meaning there is a big range of categories in terms of education, in terms of capacity, in terms of understanding. Different indicators make them different, though they are all called youth. So my question is this, it can go to Solange or any of the panelists. What are the mechanisms in place to ensure that all youth, different categories, even those with middle education level, they are tapping into these opportunities? We have opportunities. Many may not know them, but what are the mechanisms in place that young people, not much educated, but are knowing these opportunities and are tapping into them on the right time? Thank you.
Thank you very much. The next question. And I will request that you get straight to the point because of time.
Thank you. I would like to, first of all, I appreciate the panel and for the insightful presentations. My question goes to early pregnancies mentioned by Deja, and I think most of the people mentioned about early pregnancies or teen pregnancies. When we talk about teen pregnancies and the issue we're talking about that we probably are not getting to the sexual reproductive rights, what are we, like, what are the barriers to achieve the sexual reproductive rights? Because early pregnancy, and I think we need to look at the barriers that restrict us to get to those rights. That's one. Two, allow me to ask the next question, please. Thank you.
Go ahead.
We talk about now if they achieve the sexual reproductive health, coming from a law enforcement background, I'm imagining these teen pregnancies that maybe can start from, let's say, 12, 13, and all that. So how do we strike a balance in providing those sexual reproductive rights and preventing defilement? Because it means that we're accepting these young girls that are 12, below 18 years, to access the rights, let's say family planning, of course sometimes which family they don't have, and they have that right. But how do we strike the balance to prevent defilement and also give them the rights to achieve sexual reproductive rights?
Yes.
Thank you.
So yeah, I think the panelists are noting the questions. Please note the question and the one you think is most relevant to you to answer. So we have the final, that's a youth representative, a male, right? I can see. Okay, go ahead and ask the question.
Okay, thank you very much. My name is Sabiti from Keti Press and Radio Flash. I'm not a youth because I'm above 45. Though even I look like
my bad. I can't see the audience. The light is
I look like a young man, but I'm very old actually.
Great.
49.
Oh.
The lady over there has almost answered. She has almost asked my question, but. I'm a journalist and I'm wondering, when we look at the commitment number 2, which is legislative, policy and strategic frameworks, you find that among the challenges that were listed, the challenge of legal limitations on age for having rights to decide on reproductive health and access to SRH for young people below 18. Now, Evode was very categorical that we have to have meaningful engagement. And for me, when you talk about meaningful engagement, when you are limiting young people to actually express I have attended almost every conference where youth have been asked on this issue of access to sexual reproductive health services. One thing they say is the problem of limitation. So how are you going to engage youth meaningfully, yet they are telling you what they think, but the law is hitting them back? Let me give you an example. In Rwanda today, we have a problem of young women getting pregnant. I am a parent. Most of you are parents here. You cannot stop your child from having sex, but let's let them have protected sex. So how are you going to have meaningful engagement of youth, yet at one hand is tied behind? You're telling them, you know, you come and sit on the same table with us and we discuss, but yet their problem is actually being limited. Their issues are being limited by the law. For example, if a child can have protected sex, it will stop them from being pregnant, it will stop them from getting HIV and other diseases.
Yes.
So my question is to the whole panel, and let us think as parents. Because even the Parliament of Rwanda has failed to decide on this issue.
Yeah, thank you.
So,
do you have another question? Yeah, thank you very much. Time is not on our side.
We're going to have one on the panel.
Yes.
The lady who's already there can ask a question and have this final one.
Okay.
Thank you.
We have one more there. Okay, as we wait, can we receive Yvonne? Yvonne is one of the youth representatives here, and more specifically, she's representing also a lot of young people who, some are here, some are not, people with disability, young people with disabilities. So I'm sure she's a brilliant woman who has a lot of questions, but she has probably one or two, so I will welcome her to ask the panelists. Yvonne, you're welcome.
Yes, thank you to give me this time. I would like to ask, maybe I don't know who exactly I'm going to ask this question, but as Annette said, I'm here for representing the all youth with disability. I would like to ask this question. There are 6 commitments, and I think there's no any commitment which is there for only people or youth with disability. I would like to ask how the people with disability, or sorry to say people, youth with disability, how will they access SRHR? Because there is a commitment which is saying to increase utilization of SRHR, and it is here in Rwanda we still have a longest journey. If the youth without disability, they are not accessing SRHR, that's why ICPD25 is there, 30 and maybe 35 will be there to continue to look after those problems adolescents and youth are facing by not accessing SRHR. When it comes to those youth with disability, it is like it's a big issue. It's a crisis, if I can say. There's no commitment which is very, very friendly, or which is there for youth with disability. What are you doing as ICPD, if I can say, or UNFPA, or those who are in charge of SRHR or engaging youth? What are they doing to engage those youth with disability? Because there are many problems, and there are many different kind of disability. Because like me, I'm visual impaired. The problem I can face when I'm going to access SRHR is not the same with the person who is little people, or who is a deaf person, who has physical disability, or who has mental disability are going to face. So we want that kind of solution which we categorize those kinds of disability to make it really easy or to make it really friendly for those youth with disability according to the kind of disability. I would like to ask if there's any way, or there's anyhow they are going to look after the solution which will be very, very friendly to the youth with disability according to the kind of disability.
Thank you very much, Yvonne. A round of applause for everyone who has asked so far. We have one more question to go.
Thank you very much. I'm Babazi Fiat, one of the youth panel members in Mekwe program that embraces intersectionality lens in youth on SRHR in youth with compounded vulnerabilities. My question is on country commitments. 1, increase domestic budgetary allocation to health. We've seen that 15% of the budget have been allocated to health, but I would want to know particularly the percentage of the budget that has been allocated to actually solve issues in youth on SRHR. Thank you very much.
Thank you so much, my audience. A round of applause for everyone who has asked questions. Yes, now to the panelists. We have a set of about 5 questions. One of them has a B, and I'd like to read them through roughly, so you can tell me whoever wants to respond to the questions. Yes, so the first question was about youth not being just general. There are people with specific needs, and she mentioned youth who do not have adequate education. How are those being helped or engaged? The other question was from a lady that talked about, she drew on the law and how we can draw the line between rights and also child protection, about especially the human reproductive health law that restricts adolescents from accessing services, which was also asked by the next person that asked questions, the journalist. He asked about the boundaries, the barriers, legislative barriers that are still there. how do we talk about meaningful youth participation and engagement and still, don't listen to their voices? We also have a question on how there's no commitment specifically on youth with disabilities and how they're being engaged with their special needs because they have different special needs. And the last question was asking strictly if there is a budget allocated for SRHR for young people, for the youth, instead, besides the 15% budget allocation that goes to health. So I would love if each one of you responded to at least one question, and time is not on our side. If you can go straight to the point, answer one question. I'll start from Evode. Which question do you want to take? And we'll be real quick.
Well, let me take the teenage pregnancy barriers and, of course, the consent issue. Well, I remember since 2017 we've been having a strong advocacy to see how young people, especially the one below 18 years, can have a chance. I think it's not even a chance. How can have their light to access the services the way whenever they need services. Because as it was presented in the progress, on the commitment number 2, there is still a gap in the Rwanda Reproductive Health Law, Article 7. Where a young person who is not yet 18 can't go alone at the health facility to access the services regarding to their sexual reproductive health. So, but I think this aligns with our society background. We still have a lot that we need to clear in our mind and understand probably what is the necessity and what is the most important thing to do, and how do we need to prepare our young people to even remove all the worries that we have. So there is nothing like one thing to do which can solve the issues that young people have. There's nothing that can be done to solve the friendly access to service and information as a standalone. But again, this needs to be a holistic way. The worry that our parents have, that maybe the leaders, the member of parliament and so on, of allowing access to service to the young people, that's not the problem. How do we get prepared to educate them holistically without just going around? Educate them appropriately, prepare them appropriately from the childhood. And then whenever they reach that level to need to seek services, they go seeking the services when they are prepared.
And informed.
When they know what they are asking for, when they are informed about each and every thing they want. So that's the main solution. Obstructing access to services is not a solution. And I need maybe the duty bearers here to understand one thing. Allowing the access to service to the adolescent doesn't mean promoting the sexuality or telling them to go and have sex. No. Whenever you prepare your young one from the childhood, whenever you avail the service accurately, it means you reduce all the consequences that they may get regarding their sexual reproductive health. Because he said about it well, having sex is something which is done behind the curtains. However much you can be a blind parent, you will never see your kid having sex. Maybe you can suspect it, but you can suspect it when it has happened. So how do you prepare them, even way before they think about having that sex?
Yes.
Whenever they're informed or not, how do you prepare the environment to give them access to the protection, to make sure that even when they decided to have that sex beyond your control, they have a protected and safe sex. So to me, I think that's where the country should be going. That's the young people that the country should be having. The young people who are very well informed, prepared to reduce all those consequences, whether they decided to have sex, whether they don't because of the education that you've given them.
Yes.
So that can solve all these teenage pregnancies, the legal barriers issues, and the access to services. Yeah, of course, as healthcare providers, with our attitudes.
Yes. Thank you. Renata, do you want to respond to one question at least and the questions that have been asked so we can go ahead?
Yes,
and
if you
can
don't mind, just 1 minute, because
yes, 1 minute.
Age of consent to service is actually my core background, being a human rights lawyer, and I've actually specialized on that specifically. I understand the question of the balance between protection and rights when we're talking about minors. And what we kind of tend to recommend is that the principle of developing capacity and best interest of the child is key. While we want to protect them from predators, we also need to acknowledge and evidence shared that with us that young people do engage in consensual sexual acts. And this something will be happening, happens today, it will happen, and it is there and it's been happening. What we recommend is for countries to check what is the evidence vis-a-vis sexual abuse. I can't disclose data at the moment because it hasn't been validated, but UNFPA with IPAR and CKIN is now conducting a study in the 30 districts on adolescent pregnancy to appreciate what is the magnitude of the issue and what are the root causes of the issue. But the data, the quantitative data has not been yet validated, and therefore I won't be sharing it here. But what I can tell you is that it seems that the average sexual abuse is below 18. And when that is the case, it can be as young as 12 and as old as 24, because there's an average. Now, as a country, we need to decide about the caring of the ones that are between the 12, 13, 14, 15, and what's not, and look into mitigation strategies. From a legal perspective, because the question was about protection and law enforcement, so from a legal perspective, we usually recommend to include something called close-in age, or Romeo and Juliet clause within the law that allows young people who have consensual sex below the age of 18 to do so within an age bracket of a difference. For instance, if he is 17 and I'm 15, it's 2 years difference. Developing capacity is very similar. It means my brain, my ability to understand at 15 is very similar than the ability of understanding of a 17. In that case, we don't criminalize consensual sex. But we do criminalize consensual sex, for instance, when you have a 24 years old with a 16 years old. Because in that case, the age bracket is much larger. That is a way of appreciating, and please, let's really reflect on it, that young people are able to understand and they do have developing capacity, and they can make decisions about their sexuality, and they do make decisions about your sexuality. So I think there are strategies that can help us consciously balancing rights and protection without violating the rights of young people, because that's the bottom line.
Yes.
And also, just to give you a visual, and the many parents, as the previous speaker said, there are many parents here. Would you throw your child into the sea without teaching him or her how to swim? You wouldn't do that. You know they're going to drown. So why do we do that with sexuality? And when we talk about sexual reproductive health services, let's clarify, we're not talking about only giving out condoms. We also talk about information.
Yes.
But children will not go, adolescents will not go to a clinic knowing that if I approach the nurse knows I'm 15, she knows by the law I'm not supposed even to think about it. Therefore, I'm not getting the information that is going to prevent certain consequences.
Yes.
So I think those were the things. And quickly on the leave no one behind, just to give another answer to another question. UNFPA worked on something called Breaking the Silence, which is basically adapting comprehensive sexuality education for young people with disabilities. Now, Yvonne, you said it very right. Disabilities are very many, and often it's very difficult to work around all of them and make sure that whatever we deliver, either from an education point of view or a health or services point of view, is truly fitting the needs of the different disabilities. But we're progressing with it. We're trying to find ways of becoming as inclusive as possible, and we support governments to do the same. But we cannot do this without associations of people with disabilities. We go back there. Participation is not just a matter of young people. We also need to have specialized partnerships with associations that do have the expertise that is required. So definitely there's much more that needs to be done, but we have started.
Yes, thank you very much, Renata. And now I will move to Isabel. If you can respond to one of these questions, and then I'll come to Tetero. Okay, that would be fine. We can. Microphone.
I said Renata has said almost everything, but it's on a teenage pregnancy. What I wanted to add is information, because you may facilitate access to services, but if you don't really provide the right information to these teens or to the kids at the early age, you're not doing anything. I think as parents, I know some parents here, we should work on this. You cannot look for one way to solve the question of teenage pregnancy prevention. You cannot say this is for Menedik, this is for Ministry of Health, this is for Mijeprof. No, I think everyone, all their efforts are put together to find solution to teenage pregnancy, but starting from home. Because if you do not start from home, you cannot blame healthcare facilities. Start from home. It's your child. You are responsible to provide this information to your kids.
Yes.
And of course, making sure that efforts are coordinated and the kids or the young people are having access to the right information very easily in a youth-friendly way. And providing, of course, tools to the parents, to support the parents to be able to provide the right information. On disability, I said, Renata just said it, but it's for the young people as well. You are disabled, but it doesn't mean you don't have like ideas, good ideas. You cannot contribute. For you to be here, it's a good thing. You are asking questions, good questions. You are representing others. And I think maybe the next commitment, the people should think about it. But I know UNFPA is working on this as other institutions.
Yeah, thank you very much, Isabel, and thank you, Evode and Renata. Now to our last panelist, the final panelist. I think most of the questions have been tackled. They've talked about the teenage pregnancy issue, the law, binding adolescents to access services. They have talked about which are the legislative barriers. They have talked about engagement of youth with disability. And now we have one more question that talks about budgetary allocation for solving SRHR issues as the DEJ of youth empowerment. Would you talk about that, or do you want to maybe talk about something else?
Okay, I'll talk about what you want me to talk about because you're the moderator. Of course, I want first to address the issue that was raised about mechanisms in place. Number one, services are there. We have youth corners, we have youth centers, we have policies, we have strategies. But when you look at what's happening in the ground, you see that some gaps are still there, and I think that's why you asked the question. Some gaps are still there, and that calls for everybody's participation to make sure that we close those gaps and that young people are informed about what's there. Because you can say youth corners in a health center, and when you talk to a young person in a certain sector or in a certain district, they don't know about those youth corners. They've not even been to the health center to ask about sexual reproductive health information. So I think we need to invest more in making sure that those information reach the right people, the young people in the community, and I think there's a lot again being done by different partners, radio talk shows, campaigns, roadshow campaigns, and so on. But still, gaps are still there, and everybody in the room can do something, and other young people in the community can do something to make sure that young people know about what's there that they can tap into to have information about opportunities and information about SRH. Lastly, about the budget. This is a very nice question, and I think Minisante, the Minister of Health, can respond to this. But if we say, we talk about 50% of the budget, of the government budget, being invested in the health sector, guys, that is a lot of money. It is a lot of money, I'm telling you. And I'm sure that a big chunk of this money is going into supporting the access to information and sexual reproductive health services of young people. I don't think you can exactly say it's 10%, it's 1%, but I'm sure that that is also the area that the Ministry of Health is focusing on. Thank you.
Yes, thank you very much. I'd like to remind the audience that for whatever question we cannot have an absolute answer to it, means that we have, it's an advocacy issue for all of us. So we should take it up, and everyone has an equal role in preventing, eradicating any form of exclusion that we do not want to see in realizing ICPD 2030 commitments. Thank you very much for your patience. Allow me to thank Isabel, thank you Evode, thank you Renata, and thank you Tetero. Thank you very much. A round of applause to them as they take their seats. Thank you very much, dear panelists. Thank you for sharing knowledge. I know this was a lot, but thank you very much for sharing your knowledge with us. Now, ladies and gentlemen, allow me to welcome Taina, the MC of the day. Thank you for giving us this time, and have a brilliant day. Thank you.
A round of applause for Annette as well for doing such a good job. This was an insightful panel discussion, and I could see that people still have questions or comments. You know, this is just a pause for a long conversation that we are about to have from today moving forward. On Twitter, we can still engage. Feel free to take contact of people before they leave. If you need a specific number on the budget, I think someone from MCCH should have your number and get back to you on that. But all I can say is that it was a very positive and engaging conversation that we've had since this morning. Ladies and gentlemen, as they compile recommendations, I'll give them 2 minutes to do that. But in those 2 minutes, we are going to sing and dance. I said sing and do what? Okay, I count on your collaboration on that as I welcome our very own Bukuru for the performance.
Thank you so much. Agasaza gashiramanga kasanze ngw'inkumi iryamye katibyukunyoza ibirenge urakozwa na nyabarongo harongo umugezi utemba. You cannot dance to this song and still sit down. By all means. kagasaza gashiramanga kasanze ngo inkumi iryamye katibyukunyoza ibirenge urakozwa na Nyabarongo hayiwe Nyabarongo umugezi utemba waramamihorere none waramamihorere none waramamihorere none waramamihorere none ngo mpore 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 wararaye impore mpore mpore we mpore wararaye ngo mpore 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 wararaye impore mpore mpore we mpore wararaye ngo mfizi yanjye rwivugira mu gituza gituma nyikunda yananiye abagambanyi mpore 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 wararaye mpore 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 we mpore wararaye nsabaniza yozaraye zigishutse mpore 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 wararaye mpore 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 we maharewate mbaho maribori naramubonye ahagorora ikimero hakebutsa byendo icyo kibi niko kumwita umwaga kurutwa sumwe mwita amarebe yera nsubiye mwita amarebe yera kandi atemba uhamaribori warakoze mana warakoze mana warakoze mana warakoze mana warakoze gitare warakoze mana nauhanye nawe warakoze mana warakoze mana warakoze mana nauhanye nawe warakoze mana oh warakoze mana. Thank you so much. Thank you for dancing with me. I'm gonna sing one more song while we wait for the MC to come back. Inyange muhora cheye uwana twaganaga nkura mukije ntera hejuru ngogeza nguri mbinyamibwa ngendo kizihiza ura nzakomeza ndirimbe ya mbyino y'urukundo rudakanywa n'ibihita niruhindwe n'ihururu niruhoshe ngo ruhore cyangwa ruhonge ninjye barushikirezi urebe ugatemba imbabazi ni mumure barasa
n'isimbi mwebwe mwamukurahe kwari irembo ryiza rimwe ritahe nyami ibwami dore ibiganza bikabamariza wari umubyeyi tukagusanga nongere ngire ntikaramukuranye ituze nzahira kuzikuza n'urusogo rwiza rusagambanya kurama we rugasusurutsa umurima wose narya zuba nirizime Thank you so much.
That was not enough. Oh, this was good. What a way to celebrate partnerships, friendships that will drive this agenda moving forward. Thank you so much, Bukuru, for the performance. Ladies and gentlemen, to conclude in style, we are going to listen to the recommendations and closing remarks by Dr. François Regis from MCCH RBC. It's been a pleasure emceeing this event. Right after the closing remarks, we'll head out to lunch before we can depart. Make sure that you leave after making a new friend today. That's the challenge, okay? Don't leave without a new friend. So thank you so much and have a lovely day. Dr. Regis, you're welcome.
Ladies and gentlemen, today we have discussed many things which are important, and it has been also proven that youth engagement in those ICPD commitments is a big investment toward the achievement of zero maternal deaths, zero unmet need of pregnancies, unmet need of family planning services, and also it is a good way to empower our adolescents, our girls, our women, and this really will help us to achieve the SDGs. And some of the resolutions and recommendations have been identified during the discussions from morning up to the latest, which was the panel discussions and some more questions. Among them, we found that there is a need to promote a meaningful and inclusive youth participation in all country priorities and agenda. This involves to involve them from the planning, from making a policy, strategies, and also to go with them during the journey of implementation of those policies and strategies. In the area of partnership, it was also recommended that there is a need of partnership, there is a need of partnership, especially in generating solutions based on the local needs of our youth and all populations. With regards to the youth engagement, we realized that ICPD25 commitment the ICPD25 commitments, which have been, I see it. Okay. So we realized that there is a need to address inequalities by leaving no one behind through the inclusive policies and strategies, as well as the interventions. It has been demonstrated by the UNFPA Deputy Country Representative. So when talking about youth, we need to think this all segments or all sections, which may include also different variables which should be considered by addressing youth needs, by listening them, and also by giving them the chance to fulfill their potential. The action items which have been taken, it's accountability. There is a need of accountability of our youth, and also for the government, especially in making those different commitments, but also in their implementation. There is also a need to address some barriers related to access to the reproductive health services for our youth people, with leaving no one behind, and also by trying to reach the marginalized youth groups. And also there is a need to advocate for youth so that they can also raise their voice, especially when we are discussing on different issues related to adolescent sexual reproductive health. So, dear Deputy Country Representative, dear government officials, dear partners, dear youth, allow me to highlight that there is really a need of supporting our youth to engage them toward this journey of ICPD25. This also will help us to address some issues related to adolescent health, especially the high teenage pregnancies, which now in our country is around 5% of youth. We may understand that the 5% is small, but given the structure, the pyramid or the structure of our population, most of them, they are youth. So the 5% is millions. So this is also an opportunity to create, to empower our youth so that they can also cross the period of their adolescence safely, and this will also allow the country to have the empowered adults, which also will help the development of our country towards the Rwanda we want vision, but also the development of the whole globe. So we are also calling upon the youth also, leaders to support, to use the opportunities, especially the government commitment, the government leadership, which really have have put the strengths of our youth ahead, and they are the front runners to the development of our country, to the development of different programs related to gender, related to the development, but also related to health. I am calling upon the government officials representing different institutions, especially the Ministry of Health, the Ministry of Education, the Ministry of Gender and Family Promotion, so that they have also, in collaboration with different partners, we need really to work hand in hand to take in our hands those sexual reproductive health issues or challenges we are facing, and try to extend our arms, not just putting them behind, but extend our arms and put ourselves in the shoes of those adolescents, so that when we will be thinking, we have not to think as adults. We don't need to think on our pride, but think on the health of our adolescents. So let's join our hands, let's work together, let's engage our youth, and this really will help us to achieve the sustainable development of our country and of our whole globe. So thank you very much. Esther Innocent, I would like to close this meeting on behalf of HOD Dr. Parfait, who have had an urgent meeting, which didn't allow him to be here with us today. But I can assure you that he's also one of the key person who is monitoring this, so he is with us along this journey. Thank you very much.
Another round and final applause for everyone. Dr. Regis, the amazing panelist, the Honorable Minister who was with us earlier. Today has been amazing. I think there's still a lot to unpack. There's still a lot to reflect about. The journey continues. Let's stick together. Let's, maintain the meaningful partnerships that we've created so far. I'd like to confirm if everyone has received their lunch voucher. Correct? And if you didn't go through the process of registration, please find our volunteers at the exit and do that. Last but definitely not least, please don't forget to check out the exhibition area. We have so many organizations and programs and projects that are portraying what they do on a daily basis, which we could draw inspiration from. Again, it's been a pleasure. Bon appétit.
Ingaruka ziva mu kubyara ukiri umwana ni uko ucikiriza amashuri, iwanyu babireba nabi, uba usanga mbega nta burenganzira bakiguye umaze gutwara inda,
cyangwa se agahuriramo n'ibibazo by'uko ashobora no kwiyahura akaba yanapfa. Hari igihe ahuramo n'ingaruka z'uko nyine yafashwe ku ngufu, aterwa indwara zandurira mu mibonano mpuzabitsina.
Ikibazo afite cy'ubumuga ni cyo kutagenda. Ikindi kibazo afite ni icyo kutumva neza. Ni icyo mbega umurebye ubona ingingo ze zose ari nka pararize. Nta rugingo ubona ruzima yaba afite. mu gusama kwe kubera buno burwayi afite yabaga hano ku mbuga ntabwo yajyaga hava, yahavaga kenshi agiye nk'aha gutya hafi y'urugo, nyuma y'amezi runaka tubona inda ni nkuru, ntabwo tuzi ngo rero ngo inda yayihawe na runaka cyangwa yayifashe mu buryo ubu n'ubu, twabonye inda ari nkuru.
Ingaruka zo kuba wava mu ishuri ukarita kandi wari ufite gahunda yo gukomeza kwiga, ukaba wahura n'izindi ngaruka nyinshi cyane zishobora gutuma ubuzima bwawe busubira inyuma, ukaba wakiheba nawe ubwawe ukumva uriyanze.
Iyo wabyaye ukiri mutoya urungano muba muri kumwe narwo ruguha akato rukayi nyine rugufata nk'umuntu mbega nyine wabasebeje, wowe urabiyegereza bo bakaguhunga ariko bageraho bakakwegera nawe